Last month, the state released a plan to bring an end to suicide statewide. Cronkite News reporter Angelie Meehan has more on the state's mission to reduce suicide statewide. Angelie?
After the Arizona Department of Health Services reviewed a previous plan from 2010 to 2014, they decided to update it. Regional meetings with community stakeholders were held for about 6 months across the state for feedback on what to incorporate into the new suicide state plan. This year's ultimate goal? To reach that number of 0. Memories of Robbie run through his mind.
Well, this was the last one that he took out there at the raceway.
Bob Adelson's son, who loved cars, ended his own life about a week after this picture was taken.
We were best friends. We were really close. He was my only child.
In hopes of reducing the number of suicides in Arizona, the state has taken on the issue in its updated 2015 Suicide State Plan.
We want to reduce stigma with this plan and make sure that anybody who's dealing with depression or loneliness or is considering taking their life knows how they can get help, and we do have those resources available in our state.
The plan targets risk groups such as American Indians who endure a higher rate of suicide than the rest of the state.
Many grandparents or traditional elders might say, you know, it's taboo to speak about it.
Debbie Manuel trains Native youth in suicide prevention. After several years in her line of work, she has seen the advantage in talking about it.
I have learned that it's extremely vital to talk about suicide prevention with our young people.
Survivor Waylon Pahona remembers when he thought about the unthinkable.
2007 was a very bad year for me. I ended up hurting my back.
An inability to exercise and a near breakup with his girlfriend at the time left him feeling hopeless.
And from that moment, I felt that I didn't want to be on this earth. And so what I did was I tried to take my life.
And now Waylon speaks professionally across the continent, moving Native audiences with his story.
Ask those questions. Get the conversation going. So then you can then go to the next step, which is to refer them to someone where they can get help.
We all can share and we all can, get some help too, because, I did and it really helped.
Leadership at the Arizona Department of Health Services plans to update the suicide state plan every year as opposed to every 5 years, including improving the timeliness of data collection regarding suicide deaths in the state. Live in the Media Center, Angelie Meehan, Cronkite News.